Okay, to start, I would like to talk about safety. I wear a helmet when I am assessing a horse, especially important when you're doing ting points, etc. But at any time, you never know when a horse could spook and bump into you, so I do that. I also have composite sole boots, which are good. I like to have an assistant. Unfortunately, I don't have one today, but I do like to have an assistant. And I'm very careful to stay out of kick regions, especially of a horse I don't know. If it's a horse I know well and I'm comfortable, of course I'm going to take a little bit more liberty, but I'm always very cautious about the kick zones. So the first thing that I do is when I arrive, I do have forms that I show to the horse owner, and I ask them to complete these forms, and they have a complete history of the horse. So it's going to have its age, its breed, and type of work that it's in, how much work, the style of riding that is done, feeding, any illnesses, any injuries, scars, etc., behavioral issues or typical behavior and horsenality characteristics. So all those things I'm going to record to give me information on the horse. So before I work with a horse, I connect with the horse. I start with coherent breathing and I do a bladder meridian opening. Bladder meridian opening, I run the palm of my hand from the pole all the way down to the hock. I don't take my hands off. I walk them back up. You can see he's already starting to yawn. He does respond very well to this. I do this 3 times on each side. And then before I start the full assessment, I do a gastro assessment. For the gastro, I'm going to start by checking the brachiocephalic muscle around stomach 10. I then check around the pericardium 1 area. I go over the top of the scapula and then up to the spine at about a 45-degree angle. I then go across the ribs at approximately liver 13 area. I go down the haunch and the poverty groove. And then I do the center line from CV17 to CV8. If I get any response to the gastro check, then I will immediately go to do a gastro protocol. And depending on if there are any other symptoms, I might even go and do some colic protocols. But I would not continue my assessment at that time until that had been resolved. So the next thing I do are the vitals. I start with the heart rate. And I take the heart rate. Just in behind on the ribs till I can find it. And I check the heart rate. I also have a thermometer. I use the thermometer, of course, under the tail, using Vaseline for ease of entry. I check respiration rate. Usually I'm putting my hand right here and feeling for respiration rate. I also look for a pulse in the neck. If I feel any pulse in either finger 1, 2, and 3, that could help determine a meridian connection. And I check for digital pulses on all 4 feet. A good time to check for gut sounds is when you're doing the respiration rate, because this is the area where you would hear them. Then I do a visual check, and for the visual check, I'm going to look at the face, I'm going to look for symmetry and alignment, I'm going to look for skeletal alignment, shoulder alignment at the height. I'll look at the posture, and looking at the chart, that would also give me a meridian connection for my assessment. I do a rib check, starting at the back of the ribs in the center and running forward to see if any individual rib creates a response. I look at the body score, I check for scars, and I check the coat and look to see if the coat is showing any signs that might indicate an issue such as Cushing's. So for the rib check, start behind the back rib, and I would slowly go forward, looking for any reaction on any rib. Then I look at the teeth. For the teeth, I'm going to start with looking the temporal muscles to see whether they're even and balanced. Then I'm going to look to see if the teeth are aligned at the front. I'm going to check the curve of spee. And the angle of Cameron. And then I'm going to look at tongue color, gum color, and I'm going to do a little test for capillary refill by pressing on the gum and seeing how long it takes for the blood to return to the area. Color also can give me a meridian connection for when I'm looking for a major meridian. So I'm going to check the hyoid, and I would start at the TMJ and press in and look for any release. And then I'm going to go to large intestine 20, just on the upper gum, press in there. And then the occiput, which is the gallbladder and bladder, gallbladder 20, bladder 10 area. And then small intestine 16 between the second and third vertebra. I'm going to check stomach 10, just below where the fifth and sixth vertebra, cervical vertebra join. And then, of course, the most important for the hyoid is to check underneath the mandibular ramus. And I'm going to check and see if the spacing on each side is equal, or if I get any reaction when I press into that space.